Hello, how's your bowel feeling today? Is everything working smoothly or are you experiencing some issues? In today's video, we're going to discuss the 7 warning signs of colorectal cancer and why it's crucial to be informed about this disease. Colorectal cancer is the 3rd most common type of cancer and the 2nd leading cause of cancer-related deaths. It accounts for about 10% of all cancer fatalities. So it's important to stay informed. I'll divide this video into 2 sections. In the first part, I'll cover the signs and symptoms of colorectal cancer, the ones you might notice if something seems off. These are the warning signs to watch out for. Then in the second part, which I believe is the most vital, I'll focus on prevention, the lifestyle habits, foods and practices that can help you reduce your risk. I'll also discuss polyps and explain why the incidence of colon cancer is rising among people under 50. This is going to be a thorough video, so stick around until the end. And I'd love to hear from you. Do you know anyone who has been affected by colon cancer? And whether it was treated in time? Share in the comments below. Now let's get started. What are the 7 warning signs that could indicate something is wrong with your bowel? Symptom 7. Changes in bowel habits. Knowing your own bowel habits is essential. Some people have a bowel movement right after breakfast, while others might go 2 or 3 times a day, and some may only go a few times a week. What's normal for you? If you notice any changes in your bowel patterns, take note. Bowel habit changes are common, but you should be cautious. By themselves, they're not always cause for alarm. However, if these changes persist or worsen, consult a doctor. Around 65% of individuals with bowel cancer report changes in their bowel habits. These changes can vary depending on the tumor's location, size and stage. Stools might alter in consistency, color or frequency. You might experience diarrhea unrelated to any viral infection that lasts for days, or alternating bouts of constipation and diarrhea. Be vigilant if there's a significant shift in your bowel habits. Symptom 6. Blood in the stool. This is why it's crucial to observe your stools before flushing. What types of bleeding should concern you? The large intestine consists of several parts: the ascending colon, transverse colon, descending colon, sigmoid colon, rectum and anus. The right side of the colon is larger and usually has liquid stools because it absorbs water. If a tumor is located in the right side, such as in the ascending colon, there might not be any blockage symptoms. Instead, the tumor might bleed more, potentially causing anemia or making stools appear black and tar-like, which has a particularly foul odor. Conversely, on the left side, where the colon is smaller and stools are more solid, there may be bright red blood that drips into the toilet or appears on toilet paper. Bleeding could result from other conditions, such as hemorrhoids, anal fissures, or even foods like beets, but it's vital to rule out serious causes. Never assume that bleeding is simply due to hemorrhoids. Bleeding can range from small amounts in the stool to more severe cases. It could happen due to a tumor ulcerating, a ruptured blood vessel, a wound in the bowel, or even pressure causing bleeding. Remember, blood in the stool should always be checked by a doctor. It doesn't automatically mean colon cancer, but it's wise to investigate. Symptom 5. Abdominal pain. If you've never had abdominal pain and suddenly experience severe cramping that comes and goes, or pain during bowel movements, this could be a warning sign, especially if it affects the rectum. Seek medical advice. It might just be gas or a change in diet, but if there's no apparent reason and the pain continues, get it checked. Persistent abdominal pain may be a symptom of bowel cancer. Symptom 4. Fatigue and tiredness. This isn't the kind of tiredness you feel after a poor night's sleep. It's a deeper, more persistent fatigue that lasts for weeks or even months. In the case of colon cancer, this fatigue could be due to hidden anemia from slow bleeding of the tumor. Even with a proper diet, you might develop iron deficiency anemia, Additionally, cancer cells consume a lot of energy as they divide rapidly, which can drain your energy and nutrients, leading to chronic tiredness. Don't ignore this symptom. Symptom 3. Bloating. Abdominal bloating or swelling is another possible symptom of colon cancer. This could happen if a tumor is partially or completely blocking the bowel, causing a buildup of gas and stool. The blockage can also prevent food and fluids from passing, leading to bloating, which might be accompanied by colicky pain. While many conditions can cause bloating, frequent or unusual bloating warrants a visit to the doctor. Symptom 2. Unexplained weight loss. If you're dieting and losing weight, that's one thing. However, if you're losing weight unexpectedly, say from 70 to 65 or 63 kilos, without changing your diet, mood or exercise routine, this could be a red flag. Colorectal cancer can lead to weight loss for several reasons. The tumor may affect your body's ability to absorb nutrients, like a parasite depleting your resources. Tumors can also produce cytokines, for example TNF-alpha, interleukin 1 and 6, that suppress appetite. The cancer may increase your body's energy expenditure, causing both muscle and fat loss. It could even obstruct your digestive tract, leading to nausea and vomiting. Symptom 1. Feeling of incomplete evacuation. This is known as tenesmus, a sensation that your bowel has not emptied fully after a bowel movement. This feeling of incomplete evacuation is common with bowel cancer. It occurs when a tumor partially or completely blocks the bowel, making it feel like stool is still present when it's actually the tumor. This can also change the shape of your stool, making it thinner or ribbon-like. It's crucial to note that many people with colon cancer have no symptoms in the early stages, so it's essential to know the risk factors and consider screening for polyps. What are colorectal polyps? Colorectal cancer often begins with polyps, abnormal growths in the lining of the colon known as the mucosa. While most polyps don't turn into cancer, some can become cancerous over time. It usually takes about 10 years for a polyp to transform into cancer if not detected and removed. Risk factors for colorectal cancer. Why is colorectal cancer becoming more common in younger individuals? Like most diseases, there are several risk factors. Age. As we age, our immune defenses weaken, increasing the risk of a dormant polyp turning cancerous. Inflammatory bowel disease. Conditions like Crohn's disease or ulcerative colitis significantly raise the risk, with up to 20% of patients developing colorectal cancer. Genetic syndromes, conditions like Lynch syndrome or familial adenomatous polyposis increase risk. Family history is also important. If a close relative has had colorectal cancer, your risk is higher. Height, taller individuals may have a slightly higher risk. Controllable risk factors. What can you change to reduce your risk? Smoking. Smoking doesn't only increase the risk of lung cancer, it also raises the chances of developing cancers of the stomach, bowel, mouth, bladder, and more. Alcohol. Alcohol consumption can also increase the risk. Sedentary lifestyle. Regular exercise is essential. Diet. A diet low in fruits, vegetables, and fiber, particularly one high in ultra-processed foods, processed meats, and red meat, can increase risk. Why is colon cancer increasing among younger people? The increase is largely due to lifestyle factors. Poor diet, excessive consumption of processed and industrialized foods, insufficient physical activity, and rising rates of overweight and obesity. Seven tips to protect yourself against colon cancer. Here are 7 tips to reduce your risk, with the last one being the most important. Stay hydrated. Drink plenty of fluids, particularly water, to keep your bowel functioning well and reduce constipation. Eat a high-fiber diet. Include plenty of fruits, vegetables, and whole grains in your diet. Fiber helps speed up stool passage and reduces contact time with the colon lining. Use natural anti-inflammatories. Incorporate foods like turmeric and cinnamon into your diet. Consume dairy products. Recent research suggests that milk and dairy products may help protect against colon cancer, except for those who are lactose intolerant or allergic to milk proteins. Exercise regularly. Physical activity improves bowel function, regulates hormones, reduces inflammation, and helps maintain a healthy weight. Avoid alcohol and smoking. These are significant risk factors. Get screened. Regular screenings, such as stool tests for occult, blood or colonoscopies, are crucial, especially if you're over 45 or have risk factors. A colonoscopy is a key test because it can identify polyps before they turn cancerous, allowing them to be removed early. Preparing for a colonoscopy involves thoroughly cleaning out the bowel, which may require laxatives. During the procedure, you'll be sedated while a doctor examines your colon with a thin, lighted tube and camera.